Thank you for taking a few minutes to watch this training video outlining the steps UMass Medical School is taking to create a safe working and learning environment. As we all try to prevent the spread of COVID-19, we'll share the expectations and responsibilities of everyone who is part of our UMass Medical School community. Daily health checks help find the disease early and are one of the most effective ways to keep from spreading the coronavirus. Get started by going to umassmed.edu/IT to set up your account. And be sure to register your cell phone number so infection control can reach you if you or someone you came into contact with becomes ill. Once registered, the first thing you should do each day is to report your personal health status. You can do this online at umassmed.edu/coronavirus or by using the ServiceNow mobile app. We ask that you do this 7 days a week, regardless of whether or not you are physically coming to campus. It takes just a few seconds to review the symptoms of COVID-19 and to answer 3 easy questions. If you answer yes to having any of the COVID-19 symptoms, you must stay home. And if you become ill while you're on campus, please go home. You should notify your supervisor, your personal health care provider, and call Employee or Student Health Services. Employee Health Services can be reached at 508-793-6400, and Student Health Services can be reached by calling 508-334-2818. Wearing a surgical mask is not negotiable while you're at UMass Medical School. Surgical masks are distributed at entrances and should be worn at all times on campus, in labs, classrooms, hallways, and even outdoors. The only 2 exceptions to our universal mask policy are when an individual is alone in their office with the door closed, and masks may be briefly removed for up to 15 minutes while you are eating a meal. Homemade or fabric masks are not allowed. To be effective, masks must always cover your mouth and your nose. You should store your mask in a paper bag that is provided at the entrances to the medical school campus, and then replace your mask when it gets dirty or wet. Social distancing is critical too. Avoid gathering in groups and always maintain at least 6 feet between yourself and others. This includes common areas such as break rooms and outdoor eating spaces. In elevators, no more than 4 people are allowed at a time, and you may also take the stairs. Meal and break time should be staggered to allow for good social distancing. And while you're eating or drinking, try to stay 8 to 10 feet away from others because your mask will be briefly removed. Please don't share food, utensils, or coffee machines. It is okay to use a microwave as long as you sanitize the handle and the keypad before and after you use the microwave. And also, please don't forget to wash or sanitize your hands before and after you eat. To prevent the spread of germs, wash your hands frequently when you're on campus and always after you cough, sneeze, use the restroom, or before you handle food. Using soap and water for at least 20 seconds is preferred, but hand sanitizer is okay when you're on the go. Avoid touching your eyes, nose, mouth, or the outside of your mask. Sneeze or cough into your elbow or use a tissue, which you should throw promptly into the trash can and then perform hand hygiene afterwards. UMass Medical School's Environmental Building Services team has been cleaning high-touch surfaces in common areas multiple times each day, and this will continue. You are expected to sanitize your personal working spaces as needed. For your reference, all of the guidelines and resources to help keep the UMass Medical School community safe can be found at umassmed.edu/coronavirus. If you have any questions or concerns, email the Infection Control Officer at infection.control@umassmed.edu. Welcome back to UMass Medical School. We hope that you stay safe and healthy.